Well, good evening, everybody. We're going to go ahead and get started. My name is Tom Backley, and I'm the CEO of the Beach Cities Health District. And I want to welcome you tonight to the Safe in the South Bay series. This is our second session and living well during COVID-19. And so our goal for tonight is to provide resources and facts and tips for living well in the COVID-19 era. And you're going to be hearing from experts representing from all different sectors about how to live well during COVID. And so this is an opportunity for us to, with our panel, address some of the frequent questions that we've been receiving. So we have those, and if you do have questions, please go ahead and submit those. And we're going to be answering those as best we can and talking about what it means to live well in this new normal and how we can support local businesses, community, and ourselves thrive during these difficult times. We've talked about COVID-19 as an opportunity for us to impact what's going on. It's an emergency that is influenced by the way in which we as individuals behave. And so it's something for us to talk about and hear from our experts. So with that, I'd like to turn things over to Carrie Ann Lawson, who's going to be one of our MCs for tonight.
So good evening, and thank you for joining us. We're going to spend a little bit of time right now explaining how this will work. I'm Carrie Ann Lawson. I'm the Chief Programs Officer for the district, and between me and Lauren Nakano, we look forward to hosting a vibrant discussion for you and answering all your questions. So Lauren, if you could go ahead and introduce yourself and explain our ground rules.
Great. Thank you so much, Carrie Ann. Really excited that we're with you all tonight. Lauren Nakano, I'm the director of the Blue Zones Project here at Beach Cities Health District. And I just wanted to cover a little of the ground rules that in this virtual environment. We're going to be using the Q&A, which is on the very bottom part of the bottom bar of your screen. And so really anytime in this, during the speaking, the panelists, any part of this session from 5 to 6 p.m. tonight, we welcome questions that you submit live as we're going through this. So please feel free to do that. We also are going to be just broadcasting our panelists' screens, and then we have a slide deck for some of the information that we want to share with you. So that's what you'll be seeing. You can, in the upper right corner, look at view, and you can do it either in the speaker view or you can do it in gallery view if you want to see everybody all together. And then the other thing we just wanted to make you aware of is that we are going to be recording the session so that we can send a follow-up out to those that are on with us tonight, but also those that expressed interest in this session. And we'll send out the recorded version of this along with some resource links and information regarding for our panelists tonight. So we are going to be submitting, as I said, questions via the chat, but we also did get a fair amount of really good questions that were pre-submitted through the registration process. And so that's what we're going to cover in the first part of this session tonight. We're going to talk or try and have the panelists address some of the questions that we got in advance. And then we'll have time in the second half of the evening to take live questions from you via the Q&A feature. So we will try and get through as many as we can and are excited to introduce the panelists now that we have with us tonight. So I will kick it off. I am really thrilled to introduce Dr. William Kim. He is our Chief Medical Advisor for the Beach Cities Health District here in Redondo Beach, and he provides medical guidance and oversight to all preventive health programming and community services that we do. Dr. Kim, who currently owns and operates the Beach Cities Internal Medicine in Torrance, has more than 30 years of experience as an internist and emergency physician, and spent the majority of his career practicing medicine in the South Bay, including serving as attending physician in the emergency room of South Bay Hospital, which closed in 1998 on Prospect Avenue to form Beach Cities Health District. He has held the offices of medical director, paramedic liaison, assistant medical director, emergency chairman, and medical director during his 8 years at the community hospital.
I'd like to introduce you to Dr. David Hart. David Hart is the Director of Community Health at Always Best Care Senior Services and a faculty member in the Department of Counseling at Cal State Fullerton. He holds a Ph.D. in mental health counseling from the University of Missouri and works with a variety of clients, but primarily specializes in older adults and their families. We're pleased to welcome Dr. Hart tonight to talk with us about mental health during COVID-19.
We're also very pleased to have Dr. Jason Johnson, who is the new superintendent of Hermosa Beach City School District. He was a special education teacher in Watts for Teach for America, and later a teacher at Redondo Union High School for students with social emotional needs. He has been an assistant principal and principal for Redondo Beach Unified School District, and we're excited to welcome Dr. Johnson in Hermosa Beach.
And our final panelist this evening is Maureen Hunt. Maureen is the president and CEO of the Hermosa Beach Chamber of Commerce and Visitors Bureau for the past 18 years. Prior to that, she also worked for the Redondo Beach Chamber of Commerce, and she is one of the original creators of the Safe in the South Bay program. So as Lauren said, we've received many questions about general information regarding COVID-19, the health guidance and testing. So first, we're going to turn it over to you, Dr. Kim, to give an overview of COVID-19 in the beach cities. Dr. Kim, you're on mute.
Oh.
Oh. I think you should push the mute button again, Dr. Kim, and then we'll be ready.
Are we good?
Now we're good.
Yeah, sorry. Phones were going off in just a minute ago. Anyway, it's a pleasure to be here this evening with you all, and sorry about that technological snafu. At any rate, I'm going to go through a couple of things about COVID-19 and some statistics that you might find interesting as we keep up on it over here at Beach Cities. Most of you already know that COVID-19, the higher risk of severe illness is that in our older adults and those with underlying health problems. So far, 92% of the individuals that have passed from this horrible virus were elderly, and most of them had underlying health problems such as hypertension and diabetes, cardiovascular diseases, and neurologic problems. What's not on this slide is that more than 52% of the population of those that have passed in our LA County were of Hispanic origin. May we have the next slide, please? So transmission, we know this is spread from person to person. It needs a person to spread, which is an important point, and that's why some of our things we're pushing to slow down the spread of this disease is because this thing can't get spread from an animal or anything to a human, but person to person. And initially it was thought to be respiratory droplets only, such as someone coughs or sneezes, and then we inhale the respiratory droplet, or we pick it up by touching a surface that it landed on and then rub our eyes or touch our mouth. It's more likely to be spread when people are in close personal contact, that's within 6 feet. We'll go over that a little bit more in the future. There have been some reports and some concern that this could also be spread by aerosolization. And so that's in close, in enclosed rooms with poor ventilation. There are some studies to suggest that's a possibility. Do we have the next slide, please? State of COVID-19, these numbers are from yesterday. In LA County, we've had 288,451 cases with 6,876 deaths. When we carve it out to the beach cities, we've had a total of 1,232 cases split up by the beach, by Hermosa, Manhattan, Redondo. Redondo having the highest caseload of 611. Manhattan following at 385, and finally Hermosa at 236. We've been fortunate in our death rate in that it's we've had 20 deaths, 11 from Redondo, 5 from Manhattan, and 4 from Hermosa. It's always a sad thing, but so far that's leveled off. The average daily new cases, the 7-day average, is something we follow carefully, and you can see there was a big spike in July. And the average daily reported deaths have been dropping nicely. Now in October, we're getting down to 12 to 13. That's the 7-day average. May we have the next slide, please? So the LA County hospitalizations, this is a 3-day average. The take-home message from this slide is the huge spike we saw after Memorial Day and then the 4th of July holidays. The hospitalization rates have dropped very, very nicely in LA County. And I think through parts of California in general, we're seeing a much improved hospitalization rate. We fear that this could pick up again as we're seeing this virus start to ramp up in Europe, England, and in parts of the United States. Next slide, please. This is one of my favorite slides. It's a pretty slide. This looks at the cumulative cases per 100,000 in LA County is the black line. Below that is Inglewood, the orange line, and below that is Hawthorne. And then I'm so proud to see that the cumulative cases per 100,000 in the actual South Bay are much lower. So Hermosa topped us off, followed by Manhattan. The gray line is Torrance. The blue line is Redondo Beach. And then that purple little line is El Segundo. So we've done quite well compared to other parts of the LA County. Next slide, please. This is the Beach City's new cases per month. And not to spend a lot of time on it, it just does show once again that spike that we saw following the Memorial Day and the 4th of July holidays, where our big peak was in July and August, and now it's starting to settle back down. This is spread out by cities as well. Hermosa is green, Manhattan is red, and Redondo Beach is blue. Next slide, please. The blueprint to recovery and to opening up California is exemplified by this, this slide. You can see there's different tiers, 4 tiers. The top tier is the widespread caseload and disease. And this is determined by new cases, positive cases, and a relatively new metric is the positive test in the lowest resourced area. This is a health equity metric that measures the case burden in those underprivileged areas where there's more poverty and less income. We have to have an improvement that lasts 2 weeks in each of these metrics to move to the next tier. Some of our metrics now, as you can see, the positivity rate is in a good range. That's actually in tier 3. But unfortunately, the adjusted daily cases are still at 7.6. So we're unable to drop down into tier 2 or tier 3 until all these metrics are met. Next slide, please. Oh, big question. I get this all the time. Isolation and quarantine, what's the difference? Well, isolation is when you've been diagnosed with COVID-19. And then the disease generally in a healthier individual, if you're not getting super sick, lasts about 10 days. So we suggest you isolate yourself, and that includes inside your home. You shouldn't be around your relatives, your loved ones. Try to stay in your own room. If you have your own bathroom, try to use that. And then you can move on after you've been fever-free without using medications for 24 hours. Or if you're asymptomatic. If you think you're ill and have COVID, then you have to isolate. That starts while you're waiting for your test result. Now, those individuals that have been exposed to or close contact to COVID-19, we expect them to quarantine. Close contact means within 6 feet for 15 minutes or more, unprotected direct contact to respiratory secretions such as a cough or a sneeze. It's a tough thing, but if you even test negative, you should still abide by the quarantine rules, because looking at a large population of people that have been diagnosed with COVID-19, most became positive serologically as well as symptomatic within 5.2 days. But a couple of hundred didn't become positive until day 14 or thereafter. So using this method, we're hopefully able to diminish the spread. May we have the next slide, please? Oh, this is the most important thing. The things we can do as a community and individuals to defend ourselves from getting COVID or giving it to our loved ones: wash your hands, avoid touching your eyes and mouth with unwashed hands. If you're feeling unwell or sick, even cold symptoms, please stay home. Practice social distancing, especially by staying at home, and then wear a face covering, whether it be a proper mask or just a cloth face covering. This does help diminish the spread of this virus. The other things that are important are avoid crowds, avoid confined spaces. So outdoors is better than indoors. If you do get around people, try to stay farther apart. Apart is much safer than being close together. Next slide, please. So who is eligible to get a test at the LA County test sites? And these are free tests. Well, anyone with symptoms consistent with COVID-19 can be tested. Those who have had close contact within the last 14 days of someone who is known to be infected should be tested. Those who live or work in high-risk congregate settings, such as skilled nursing homes or homeless shelters, should be tested. We have tests available on a limited basis for those who are asymptomatic but are essential workers. And those are people who are in frequent contact with the public, such as grocery store checkers and a bunch of other industries. If you want to get a test, the first thing to do is to check with your primary care physician. She or he might want to direct you to the testing site that they prefer to use. And if they don't have that information for you, then you can go to covid19.la.gov/testing and make an appointment online. Flu shots. Well, why should we get a flu vaccine? Well, it protects us from the flu every year. This year, perhaps even more importantly, because the flu symptoms are similar to COVID symptoms. And flu every year kills tens and thousands and hundreds of thousands of people, actually. So you're going to protect yourself and others by getting the flu vaccine. And then, yes, I think that was it for that. I could briefly say, we'll talk about the flu and COVID symptoms later.
Great. Thank you so much, Dr. Kim. I just wanted to correct something I said earlier. Thank you to Craig Cadwallader, but if the view is actually going to be in Spotlight, so you don't have the ability to do the gallery view. So I apologize for that. Dr. Kim, thank you so much, because there was a number of questions that got submitted in advance that you covered this information. So, but if people have additional questions about that or other topics or sectors, please feel free to drop those in the Q&A. Next set of questions we're going to tackle are for Maureen Hunt, who is the president and CEO of our Hermosa Beach Chamber of Commerce. And we did get a number of questions about workplaces and also businesses. So the first question, Maureen, we have is, how have businesses been creatively adapting during COVID-19, and how can we support local businesses? And just go ahead and unmute yourself. Great.
How's that? Can you hear me?
Perfect. Yes, that's great.
Okay, thank you. First, I want to thank you very much for inviting me to this panel. I think it's very informative and very helpful to our residents. In answer to the question, our businesses have been very busy trying to stay afloat by getting creative with things like moving their businesses to outdoor patios. Taking part in this are many of our restaurants, retailers, gyms, nail and hair salons who have moved their businesses outside and have been getting very highly creative with their deck designs, such as by adding lots of plants, color, seating, and border designs. They've also looked into new ways of doing business, such as using QR codes to pull up paperless menus and on your cell phones, and also emailing you your receipts. We're very fortunate that we live in Southern California. However, autumn and winter is approaching, and there are times where it gets quite chilly and rainy and windy. And so our restaurants and other businesses have been looking ahead and working with our cities on permitting and guidelines to add to our outdoor patios by adding heating and coverings and plexiglass for your comfort. In doing this, they must also keep in mind that the LA County has guidelines that the patios must be open on all 3 sides. So this is very limited, and they have to get very creative on how this is all going to work. Our restaurants have also increased their to-go and delivery businesses. Our retailers have adapted to selling items online and delivering to their customers. In addition, our gyms, yoga classes, etc., have just recently started with outside limited training and are also doing a lot of personal training and instruction online. This has become very popular with people as we're sitting around at home. In trying to support our local businesses, I've been working together with other leaders from the South Bay Chambers of Commerce and the Beach City Health District staff, and we have created the Safe in the South Bay program, where businesses can take a pledge that they are following all the LA County safety guidelines. You may have seen these blue and white stickers, Safe in the South Bay, that are posted in a lot of the businesses' windows around town. And as part of this program, and in trying to help bring some additional business to our restaurants, we have put together a special promotion called Dine Out Week. And it will be going on starting today all the way through this Sunday. And during this time, all the participating restaurants who have taken the pledge will be offering our residents some very tasty specials. We encourage all of you to visit one of these restaurants, and you can have peace of mind that these restaurants are following all the safety guidelines to keep you and your family safe and healthy. Thank you.
That's great. Thank you, Maureen. A second question, kind of related, is how are restaurants and businesses keeping customers and employees safe? We know that that's such a critical part of bringing people back to businesses. So if you could cover just a little bit about that.
Sure. Well, all our businesses have been really, really busy, doing everything possible to keep their customers and employees safe during this terrible time. Each business must follow a set of protocols that are given out by the LA County Health Department. These rules are not only complicated, but also expensive for our businesses. They've all stepped up and have shown their responsibility to the community to keep not only their employees, but all their customers safe as well. Some examples are maybe by wearing their servers, for example, must wear not only their face masks, but face shields as well at all times while serving the customers. They're washing their hands frequently, using hand sanitizers, and frequently cleaning and sanitizing high traffic contact areas. These rules and regulations just seem to change regularly, and not only from the LA County, but from the state level as well. There is a lot of information and guidelines coming in every single day. Ever since the COVID pandemic started, the local chambers of commerce, along with the Safe in the South Bay group, we have all been remarkably busy supplying all our businesses with up-to-the-minute information. And believe me, there's a lot. With all these regulations and guidelines in place, it becomes quite stressful, and not just to business owners, but to the employees as well. We can all do our part to help. The businesses have the right to ask you to wear a mask. If you do not wear a mask, they have the right to ask you to leave. I ask that you please follow their policies. All these essential workers are here to serve you, so please make it easy for them. And just one more thing to keep in mind, even though restaurants and other businesses have a policy that you must wear a mask when entering, it is also important while you are waiting outside of the business, the restaurant or retail, that you keep your 6-foot distance and wear your masks. It's very, very important. And that's all I have to say on this.
Great. I saw a question come through the Q&A about where the list of restaurants and businesses are who are part of the Safe in the South Bay program. So I know, Maureen, I think they're on each of the chamber websites, and then we also have them on our Beach Cities Health District website, which is /Safe in the South Bay. So, okay. Carrie Ann, do you want to go ahead and
Sure. It's my pleasure to now ask questions of you, Dr. Johnson. And if you hear faint flute music in the background, it's because I am a working parent and it's band practice. So Dr. Johnson, can you provide some update on the status of schools and reopening?
Thank you, Carrie Ann. I'll admit that I'm a little distracted because Maureen went on and on about food, and it's around dinner time. So I will try to make it through this. Okay, so the reopening of schools, man, how much time we got for this thing? 5 minutes? Okay, I'll try to fit it all in. The reopening of schools is right now, schools are closed per the LA Department of Health. So I'll answer some of the more frequently asked questions, starting with, why is the LA Department of Health, closing schools? Well, believe it or not, the LA Department of Health, though unprecedented, does control whether or not schools can reopen with all sectors. This is per the California Department of Health and Governor Newsom. We live in Los Angeles County, and as Dr. Kim, who's amazing, by the way, and actually came in to one of my events, good to see you, Dr. Kim, he pointed out that we are currently in the purple tier. What is the purple tier? Well, for all intents and purposes, the purple tier means that schools are closed. But the question becomes of what can schools do? Well, besides providing distance learning, which, Carrie Ann, it sounds like you're intimately familiar with, schools can reopen for high need students in various areas. So for example, at Hermosa Beach, we're providing special education assessments. We're also providing services in class to our students with moderate to severe disabilities. We're providing occupational therapy on campus. And then soon we'll be providing speech and targeted services to our students with mild to moderate disabilities. And various school districts in the local South Bay area have taken the same or similar approach in order to open on a limited scope. But it does follow very, very restrictive guidances. And so one being that the reason we're able to open is because it's a cohort rule. Now, you'll have to go on the Department of Health to read all the various guidelines about the cohort rule because it is complicated and I can't explain it in 1 minute. However, I will say, though, that it limits what you can provide to students and also how many staff can support a group of students as well, too. So that kind of branches out to the larger issue about the status of schools. If the Los Angeles County were to fall into the red tier, then LA Department of Health may allow for schools to reopen. I personally believe that it seems likely that it won't just be this across the board reopening. LA Department of Health has proven to be one of the more restrictive county health departments and will likely take a phased approach. What does that mean? Well, probably it'll be starting with certain grade bands first, and then as time goes on, they'll slowly reopen more and more, starting with younger grade bands like TK to 2nd grade, and then moving up the grade levels. So I would say that is the road that school districts face when considering reopening. And yes, for all intents and purposes, school districts must follow the LA Department of Health guidelines, including when they reopen. So when schools are allowed to reopen their campuses to students, they will have to do so under all the Department of Health guidelines. If you haven't seen it, I recommend it. It's great bedside reading. It's 18 pages worth of guidance and protocols that all schools must follow. It goes from everything to the makeup of classrooms to how students need to enter and exit, protocols surrounding symptoms and isolating or quarantining students, to the basics, such as maintaining 6 feet and wearing masks. And yes, those things are required. What that effectively means, though, is that schools, when they open, won't just be able to open 5 days a week, all students. That in order to maintain such basics as 6 feet social distancing in classrooms, that schools will have to open at 50% capacity and follow what they call a hybrid schedule. A hybrid schedule means that half the students are participating in distance learning and half the students will be participating on site in order to maintain 6 feet social distancing on campus and, more importantly, in classrooms. Again, not optional, must be followed. And it really is dependent on the Department of Health either loosening or providing more restrictive guidance for schools to reopen, and schools in turn will follow. How was that? Was that 2 minutes?
That's really
Everything?
good. That's really
All
good.
right.
So Dr. Johnson, since it seems like we're going to be in this virtual environment for a while, what are some ways we can motivate our children in their schoolwork while we're all working from home?
Yeah. So first off, I just want to say thank you. I mean, this is really genuine. I have a young one at home as well too, who's very young, so nothing gets done with that child as far as independently goes. And so I really have to say, especially to our own local community here in Hermosa Beach, that our parents have really stepped up to the plate and are doing everything they possibly can to support their children. And I really don't think, no effort goes unnoticed, and our parents, having to juggle this madness. Again, I just cannot thank our families enough. And when I talk to individual parents and have those conversations, it is really amazing the dedication that we all have, to educating our children. As far as things that can be done, one is recognizing that you're not alone. I would say that's a starting point. In LA County, at least, every person is going through the same thing. And there are a lot of resources out there in order to support you. So for example, South Bay Families Connected, I think, is a great parent resource with lots of resources that they put on to support parents with ideas and support. I also think reaching out to your child's teacher. If you find that your kid is struggling with engagement, start with a teacher. That is, to me, the primary spot of someone who's going to help you engage. And the truth is, you need help. There's a reason why we send our kids to school. Is like that. Educating our children is a community effort. It cannot be done solo by a parent. So enlist your teacher in order to support that process. Also, there's school counselors that are available through our district and through other districts. And if you find that your child really is struggling, either with a lack of peer connection or struggling with their work or struggling with connecting with their teacher, a counselor could be a great facilitator to that work. And if you look on most school district websites or reach out to your principal, they can connect you with a school counselor who can help meet with your child and facilitate, either plan for growth, or just a check-in. And that kind of brings me to just some of the basics. Well, too, it's hey, what works? I will say that there are just some basics, but you already know them. A consistent schedule, and maintaining it, that is hugely important. And not everyone can because of their circumstance, but I would say if one common denominator for the difference between success in distance learning at the home and a struggle is that consistent schedule during the course of the day, which is one of the reasons why our school district and many others established a consistent schedule much akin to the school day, only via distance learning. I know it's not a replacement for school. I know people want to be back in schools, but we really are doing our best to make the best of it. And that's really thanks to our parents and our teachers. They are on the front lines and they are making it happen. And we are grateful for that, while we're working to get our kids back in school.
And then lastly, Dr. Johnson, what can we do for you? What can the community do to support schools during this time?
That is a really great question. As I kind of mentioned, I feel like that the community really is already doing it. I feel like that our parents have worked hard to stay informed. Just today I was meeting with our committee for social emotional learning. It has a lot of parents on it, and they were just talking about, and it's true, just being inundated with emails. And I can relate to that even with my child's school. That you get a lot of correspondence, and you're working your job, and you're trying to keep up with all of that. And I think that that effort alone, is to me an important step. Is just staying informed, whether it be with your child's teacher or what's happening with the school district or what's happening in the school. I think that is a Herculean effort in itself. I will say too that if I'm just going to say what it is, if you have the funds, participate in Skechers, participate in your child school's Ed Foundation, those dollars are going to go a long way. When we talk about hey, what's the state of schools? We are going into a budget crisis, and those Ed Foundation dollars, those Skechers dollars, every dollar is going to count towards staffing and making sure that we have the right personnel. So when we do return, we have enough people to do it successfully. I know it's a tough time to give, but if you can, do so. I just, that is part of the solution. And then, lastly, it's kind of twofold. I would say, pat yourself on the back. And then also pat your teacher on the back. Both need it. I think that we as parents, me included, have been giving ourselves the most enormous guilt trip for like the last, how long has it been? 6 months? God, I've lost track. And it's hard. I have an enormous guilty conscience about, what is happening with my daughter's education, particularly socialization. But at the end of the day, we're surviving this. And I think that, we've learned a lot. I think that a lot of families have banded together and figured things out. And school districts, continue to grow and get better at doing this madness better. But in that same vein too, whatever you can do to give a shout out to your teacher, I can't tell you how much a positive email or a positive comment goes such a long way. I've said it before, I'm going to say it again. Teachers are putting in hours that are unheard of in education, and to me, I liken distance learning to walking in water. Everything requires double the effort. That because you parents are on the receiving end of it. It's such a tremendous effort. And while we know that it's not perfect and that there is always room for improvement, every now and then I have to say that a boost or a recognition that we're all in this together, it just goes a long way. And we try to pay that forward as well too. I think that right now, there's, our world, has plenty of space for cynicism, has plenty of space for negativity. And I actually think that the truth is too, there's a lot of reasons to feel that way. That's the truth. There's a lot of frustration out there. But one day this will end. And you know what? We're all still going to be in this together. Ain't nobody going anywhere. So I just think it's important to keep that in mind that, our school community, our community at large, all these people are going to be right here when all this is over, and we'll have each other. And how we treated each other during this point of time, I think really is a test of who we are. So I really appreciate the South Bay community, Beach Cities, and everything that people have done to pitch in. It is just a glowing example of why I'm proud to work in the Beach Cities and have been for the last 10 years. So that was definitely an elevator speech. I hope I didn't go off the rails there, but felt the passion.
That's great. Dr. Johnson, thank you so much. And it's such a perfect segue to our next panelist, who's Dr. David Hart. I think it's a great segue, to just, this is such a tough time, and we have so much need for space and grace, in our lives. So Dr. Hart, thank you for joining us. The first question we have for you is, how do we maintain our mental health when so many things are out of our control?
Well, the first thing I would say is to hang out with Dr. Johnson. That is going to be my prescription for all of you out there. Find a way to hang out with Dr. Johnson, because it says something in the literature about surrounding yourself with happy, optimistic people. And you just kind of exuded that and exemplified that in such a meaningful way. It was a perfect bridge to this conversation. So that's a serious answer, by the way, to surround yourself with optimism, to surround yourself with people who are generally happy, right? That have a positive mood. So that's one way. But I'll also say that it's really critical to acknowledge, excuse me, I've been losing my voice today. It's really critical to acknowledge that this is a painful time. There's no way around that, right? Many of us, if not all of us, we're grieving, right? We're grieving lost life. We're grieving lost wages. We're grieving lost parts of our identities. We're grieving relationships and physical connectedness. This is a time, so when we're feeling negatively and when we're feeling sad and when we're feeling depressed and lethargic and apathetic and uncertain and unsure, I think it's really important for us to just acknowledge that it seems like a pretty normal response, right? So we want to be, how do I want to say this? We want to be gentle with ourselves, right? We don't want to beat ourselves up because we should be feeling happier. We should be feeling more motivated. We can certainly get there, and we're going to talk about that in just a second, but give yourself a little grace. Okay, so we're going to have some good days. We're going to have some not so good days. This is new territory for all of us. I mean, we're trying to kind of figure things out, and information changes by the hour. And so when we think we have a little bit of control, we've planned something and now that's not going to work and we got to go back to the drawing board. So just sort of be okay with where you're at. Know there's going to be good and bad days. And also too, that there's also going to be like this realization that coping strategies that may have worked for us, like at the beginning of the pandemic. I know like the first like month and a half, I was like, yeah, I'm learning new stuff and I'm, you know, trying the Zoom thing out, and, you know, it's going to be okay because I'm going to go back to work in like 2 months and, you know, it'll be cool. Well, I don't know. I'm like with Dr. Johnson. I'm not sure how long it's been, 7 months, 8 months, I don't know. And some of that early enthusiasm and kind of adaptability is starting to wane. So we also have to be cognizant of that and gentle with ourselves. I will also say that if you're feeling good right now, if you feel like you're not feeling terrible, that's okay too. I mean, this isn't all about we're just supposed to feel bad. I mean, I think many people are finding ways to deal with this, to cope, to adapt. And that's what we're going to talk about for the second answer to the question, which is if you feel like you're out of control, look for what you can control, right? So there are still things and behaviors and responses that we have control over. Right, so I'm going to say just a few that I think are really important because I know I don't have much time. The first one is to remain safely connected. I mean, that's really, really critical. And that probably means more of the dreaded Zoom calling. So just get used to it, buy some stock in it. So you know every time that you turn on Zoom, you're making a little bit of money. So just, you know, get on board with that. As Dr. Johnson said too, I think routine is critical. Block your time. Don't get into the vortex or the black hole of like too much TV or too much rumination about what's not working. You really want to block your time in terms of like, you know, physical movement, eating well, socially connected, learning something new. You want to make sure that that's blocked every day. And then I really am a big proponent of changing the broadcast, right? So we don't want to just solely focus on what's not working. And if you're watching the news or reading the news or tapping into social media, you're mostly hearing about what's not working. So I would really limit that to no more than an hour, hour and a half per day, really. So changing that, you know, from despair to more hopefulness. And I'm going to quickly run through a few that I think are really important. I know I don't have much time, but mindfulness and breath work, focusing on a mantra, reciting it, bringing your attention back to your breath, inhale, exhale. Moderate negative thinking. So, you know, if you're having negative thoughts about the world, ask yourself what a friend might tell you on how you might think differently. Like, what advice would you give to a friend? Living in your hands, do something, cook, garden, make something new. You know, just find a way to be in your body or live through your hands. Gratitude, find something that you're grateful for every day. Spend 5 to 10 minutes looking for what's working, but more importantly, tell somebody about it. Don't just write it down, share it out loud. Random acts of kindness, share it forward. However you want to do that. Making coffee for your partner, opening the door for somebody, moving off the sidewalk as somebody's walking towards you, all of that kind of stuff. And then infuse positivity in your surroundings. So one thing I'm just going to tell you right now, find a way to laugh. Turn on a comedy program, seek out something funny, laugh out loud and hysterically. It's going to help you feel much better. Okay, that's good. There you go. I'm on fire too tonight. What's up?
That is great. Thank you,
That was really
Dr. Hart.
Really good.
So I just to be mindful of time, I know that we have some questions that have come through on the Q&A. So Carrie Ann, I think you and I can kind of just tag team that, I believe. So let's see. So I think, Maureen, one question we had from the business perspective is, we are, moving into our, maybe it's already here, the holidays, and it's going to be a holidays like none of us have ever really experienced before. So how is the business community taking this opportunity to create new traditions, or we call them COVID safe events and things like that? Are there things happening in the community that you can share with the group?
Well, yes, actually there are. Unfortunately, the holiday season in the South Bay will not be the same this year. And with the rule of no large social gatherings, each city had to be very creative, put their thinking cap on, and come up with some new ways to celebrate. And I can speak for Hermosa Beach right now, and just to name a couple of things that we're doing as far as Halloween. Since our children are not able to go trick-or-treating this year, we'll be celebrating by having Halloween-inspired walking areas out along the Greenbelt, a home and business decorating and pumpkin carving contest, and a drive-by costume reveal. So that should hopefully keep our kids busy. And then moving on to the Christmas holiday season, we're going to be starting off a little earlier this year so we can spread out the holiday cheer throughout the November and December. And hopefully that will help the shopping be a little safer too, since our retail is down to limited capacity. So some of the things we'll be doing is starting off early November on November 7th and 8th by having Hermosa for the Holidays downtown open house. And we'll be having our business window and dining deck decorating contest, and our annual Elf on the Shelf scavenger hunt. And then on December 5th, we usually have our big holiday tree lighting with all our local nonprofits down on the plaza, but we won't be able to do that with the big crowds this year. So we've decided we'll still have our holiday tree lighting. We'll be putting our tree up, decorating the tree, and it will go virtual this year. So that will be December 5th at 6 p.m. And we have not yet got the information out, but it will be on social media. So please stand by, and you can also look at our chamber website, the Hermosa Beach Chamber of Commerce, and the city's website for more information on that. And right now, our big New Year's Eve celebration on the plaza with our big band just does not look like it's going to happen. So no large gatherings, so that will not take place this year. And as far as the other cities in the South Bay, I know they also have a lot of fun and creative holiday events planned, and you can find more information on these events by going to each city's Chamber of Commerce website and business associations and city websites. And I just want to end with one more thing. During the holiday season, there's so much stress going on, not only stress for all the residents, but stress for the businesses and their employees. And when you're out there shopping local and supporting our businesses, I'd like to ask that you please remember to be thoughtful and kind, because a little bit of kindness goes a long way. Thank you.
Thank you, Maureen. Dr. Hart, you gave a lot of good advice for being kind to ourselves and allowing for acceptance of mood changes. But how do we know when perhaps somebody really is in trouble? How do I identify a friend or a family member, or maybe even myself, who might be really struggling with their mental health and need more intervention?
Yeah, I mean, excuse me. I think you're going to notice a more acute change in behavior, right? So something that I tell my students is, if it feels weird, it's probably weird, right? So if it's different than the other members of your family and you're noticing like a change in sleeping patterns, a change in eating patterns, you know, an unwillingness to get out of bed, a change in hygiene, maybe a lot of like curmudgeon-y, agitation, irritation, restlessness. Maybe your loved one is feeling a lot of panic or hypervigilance, you know, just a lot of anxiety. I think that if you notice behavior change that is literally impairing your loved one's ability to function day to day. In other words, they're no longer able to do what they once were able to do, like go to work, take care of, you know, their meals, take care of other family members. If you're noticing that that's becoming very noticeable and what we might describe as acute, then that's probably time to reach out. And you can reach out to any healthcare professional that you trust. I mean, you can reach out to a faith person. I'm trying to think of like a clergy member. You can reach out to your primary care physician or a nurse. You can reach out to community resources. You can reach out to somebody like me, just anybody that you feel like you have a relationship with and you can trust. The bottom line is you can ask for help. There's no shame in asking for help, and the help is available. It's available. Oh, one last thing, particularly like a 10 out of 10 and like you really need to seek out help. So if you're thinking about hurting yourself or hurting somebody in your family, that's really important. That's the time that you definitely want to take action. There's no more, you've reached kind of the end of the rope per se.
Mhm.
Thank you, Dr. Hart. And then we have some really good questions. So I'm sorry we're running out of time. We wanted to end the Q&A with one final question for Dr. Kim. How do we tell the difference between COVID and the flu as we move into the fall?
That's actually a very good question because they are very, very similar. The flu generally starts with an abrupt onset of chills, myalgias, or you ache all over, and fever. Then it advances to scratchy throat and cough. COVID does the same, but in many individuals, it's not. It's more subtle. For instance, the younger folks, a lot of them complain of lack of taste and smell, but otherwise are feeling okay, a little bit tired. Others are getting excessively fatigued. Those that really do have trouble and get super ill with COVID do have the similar symptom of fever, chills, and chest tightness and a cough. Shortness of breath is much more pronounced with COVID-19 than with influenza A or B. Now, influenza A is generally upper respiratory. Influenza type B, sometimes, especially in younger folks, can be associated with gastrointestinal symptoms such as nausea and vomiting, diarrhea. Easy to test for the flu. I mean, it's a rapid test. It takes 5 minutes in my office. We were hoping to have rapid COVID testing by this fall, but currently not rolling out to the primary care docs. And then another thing, just with the flu season upon us and COVID around, is do things just to keep your health healthy. As Dr. Hart pointed out and Dr. Johnson, just have a positive attitude, eat well. If you high fiber, low fat diet, try to exercise. If you're really into supplements, some reports suggest that zinc can taken for both COVID and colds can help prevent the virus from getting set up. Low dose vitamin C is hit and miss, but it's better to try it if you want. Don't take too much. If you're going to take it, take 250 milligrams, not anymore. Exercise. And like Maureen said, there's nothing like being kind to somebody. Just spontaneous kindness, I think, gives everybody a sense of a good feel, and that stimulates these really good endorphins in our brain that help us be healthy and fight infections. So the kinder we are, I think, the better it is.
Thank you, Dr. Kim. So I'd like, as we return to our PowerPoint slides, to just highlight some of the resources that are available to the community before we close tonight. As Dr. Hart was saying, if you need help and need someone to reach out to, please think of our information and referral line here at BCHD. That's 310-374-3426, extension 256. We can answer a great many different kinds of questions. If talking to somebody on the phone isn't your style and you prefer to look things up on the internet, you can also access our resource database at bchd.org/resources. And we have a lot of information on our coronavirus pages. So we'll take the next slide. We also wanted to highlight the resources from our panelists. Maureen mentioned the Chamber's website. South Bay Families Connected, we are doing a presentation this Thursday night with South Bay Families Connected on resiliency in families during COVID-19. So please go and look that up if you're interested in that topic. And then as Dr. Hart mentioned, if you need immediate assistance because you're thinking about hurting yourself or someone else, please consider calling the Suicide Prevention Lifeline. More resources, all you could possibly want to know about COVID-19. If you can't find it on our website, is here with the county. You know, sometimes we get a lot of questions about how to report violations in workplaces and businesses. Not that we have any in our area who would do such a thing. But if you are interacting with a business or a restaurant that is not following the guidelines and you'd like to report them, you can do that with the County Department of Public Health to the Environmental Health Hotline. We also have outbreak hotline if you find someplace with 3 or more cases, and then just an information hotline with the county. So lots of opportunities to get information.
Yeah. And just to share something with you, Maureen mentioned it earlier, we have the businesses that have been participating since July in the Safe in the South Bay program. We have almost 200 businesses in the South Bay area, including PV and El Segundo and our beach cities, who have signed the pledge to say they're committed to making their retail, restaurant, other worksite environment safe for both their employees and for customers. So really excited about that. And just this week, we're rolling out a pledge that we're hoping that you all will participate in. We invite you to pull up the bchd.org/pledge. And it's really a way for the individuals in our community who, you know, it's as Tom said earlier, it's going to take all of us to get across the finish line regarding this pandemic. It's really an opportunity for all of us to step up. And so this pledge includes a lot of the things you heard about tonight that are the LA County infection control guidelines and best practices. But we also took a page from our mental health and happiness initiative and pulled in some of the things that both Dr. Johnson and Dr. Hart have talked about, that is about, you know, really trying to take care of yourself as well. And so we've included those kinds of pledge items as well. So please feel free to pull that up, take the pledge, and join us in really making a concerted effort as a community to get through this together.
And lastly, our panelists have graciously shared their contact information with you here on this slide. And I'll turn it over to Tom for our closing remarks.
Great. On behalf of the Health District, would like to thank our panelists for joining us tonight. Would like to thank staff for putting this together. And I would like to thank you for attending. And we're going to be having another one of these Safe in the South Bay series events. It's going to be on December 9th. That's a Wednesday at 5 p.m. And we look forward to seeing you then. In the meantime, please contact us if you need anything, or bchd.org if you need any information. And again, thank you for joining us, and we hope to see you soon. Thanks a lot.